Dear learner, welcome in our continuing series of lectures on the manifested e-learning platform. We are continuing with our subject of human resource management. And today in our lesson, we are looking at human resource administration. And within that human resource administration subtopic of the lesson, we are now looking at health and safety policies and procedures. We are looking at health and safety policies and procedures. And dear learner, what needs to be emphasized is that the health of a worker and the health of those associated with an organization is very critical. And that's why a lot of emphasis must be put on the administrative aspects that help in preserving the safety and the health of workers and those who are associated with what the organization does. And that's why we are going to take a bit of time on the lesson for today to be able to emphasize so that you can come out very strongly with the competencies and skills of ensuring that you are able to maintain a health and safe working environment through the safety procedures that an organization is expected to put in place. Now, when we look at health and safety policy and procedures, health and safety policy and procedures are concerned with protecting employees and other people who may be affected by what the organization produces, does, against hazards arising from their employment or their links with the organization. So you have hazards, you have what is being produced or what is being done in an organization. So dear learner, as we have emphasized, the health and safety of employees and those associated with the workplace is very critical. And that's why we are going to take a bit of time and be very sequential in terms of how we are going to look at health and safety policies and procedures. So just to emphasize again, health, safety policies and procedures are concerned with protecting employees and other people affected by what the organization produces and does against hazards arising from their employment or their links with the organization. And any lapses in the area of health and safety can actually lead to death. And that's why it is important to avoid the deaths accruing in the work environment or injuries or damage. This has to be taken very seriously. So in our lesson today, for us to realize the objectives of this lesson, we are going to look at activities in managing health and safety at work. We will look at hazards at work. We will look at action following risk assessment. We will also look at control of occupational health and hygiene problems, and also look at accident prevention. How can accidents be prevented within a working environment? So we are going to start with activities in managing health and safety at work. Activities in managing health and safety at work. So, Lana, you might be asking yourself, as a human resource person or maybe as a company secretary or somebody associated with a work environment, what are some of the activities that you may be involved in when it comes to managing health and safety at work? So there are several activities that you may be involved in, because when it comes to the law that regulates health and safety policies and procedures, the Occupational Safety and Health Act of 2007, it is a requirement that teams are created within a work environment. So you may find yourself as a team member participating in these particular processes. So what are some of the areas in which employees may have to participate? So one of them is formulation formulation of health and safety policies. Health and safety policies. So in a work environment, nowadays, employees are increasingly being involved in management. And that's why for these policies to be highly acceptable or highly, say, transcended down the organization, then an organization may have to involve employees. So as an employee, you may be involved. As a manager, you may also be involved in the formulation of health and safety policies. You may also find that another activity is conducting risk assessments. There may also be implementation. Number 3, implementation of health and safety policies. There might also be review of health and safety procedures. So activities in managing health and safety. There is also the issue of number 5, participation in health and safety committee work. There might also be the issue of sensitization of employees on health and safety. There is also the issue of investigation of work-related accidents. So basically, the activities in managing health and safety are wide, and they vary from organization to organization. But what we are saying, some of them may include formulation of health and safety policies, conducting risk assessments, implementation of health and safety policies, reviewing of health and safety procedures, participation in health and safety committee work, sensitization of employees on health and safety investigation, and investigation of worker-related accidents. Accidents may take place within a work environment, and there could also be other areas, like, for example, managing stress in the workplace. Now, this stress may be brought about by employees who have been given, for example, certain targets. Employees have certain targets to meet, and they will be stressed if the time is reaching and these employees have not met those targets. So that again becomes an issue that has to do with employees' health, employee work well-being, and so on, among other places and so on. Is it? Then there might also be other issues like health and safety, health and safety equipment, So the list is long, but these are just some of the things that you are saying that within a working environment, some of the activities may include but are not limited to what we have listed here. So that is the first part of our lesson, which is now dealing with activities in managing health and safety at work. Now, how about hazards, dear learner? How about hazards at work? What are some of the hazards at work? And what you might have noticed, dear learner, in any work environment, whether it is in the office, whether it is operating machines, whether it is at the farm, there could be some hazards that we need to be aware of so that when we are aware of those hazards, then it is possible for us to be able to bring in corrective measures. So what are some of the activities that may be associated with hazards within a work environment? So one, receiving of raw materials. Receiving of raw materials. Now, when raw materials are being received, there could be elements where now you need to carry this, for example, need to be carried, need to be moved from one place to the other, and so on. So that again could create a hazard. Then there is the issue of movement in the workplace. Movement in the workplace. So when there are movements in the workplace, there could be collisions, for example. Then operating machines, that could also create a hazard. Then you could, for example, be having issues like working at heights. You have seen, for example, say Kenya Power, you have power lines and employees are supposed to climb up there on masts, for example, for Safaricom, maybe other mobile phone companies and so on. So that working at a height could also create a hazard for employees. There is also working with hand tools. And then number 6, operating electric equipment. So when employees are working with hand tools, that hand tool could, for example, snap. And if it snaps, then that could also create a hazard. Then there is the element of operating electric machines or equipment where electricity is being used. Workers need to be very keen. Then there is also the element of sitting for long durations. So employees who sit for long durations may, for example, suffer what you call lower back pain. So that again becomes a hazard within a working environment, is it? Then you also have processing of materials. Now, these materials could lead to what you call toxic substances. When materials are being mixed, those materials could create some toxic substances. Then there is also cleaning of gutters. So employees in cleaning of gutters in confined spaces. So that again could be a hazard. Then there is also the issue of workload. Work overload. So when employees have too much work, sometimes you have seen in some workplaces, an employee has to carry work home. So that carrying that work home sometimes could also create challenges. So when these employees at the workplace for 8 hours, they are working, they go home, instead of resting, they continue working and so on. And if this workload continues, this one could lead to maybe high stress levels, as we have observed, and that one can be a hazard at maybe the work environment and so on. So these could just be some of the hazards that workers may be exposed to within a given working environment. And when this happens, or within a work environment, then employers are supposed to do what is called a risk assessment. So what are some of the action following risk assessment? So we want now to have a look at action following risk assessment. Action following risk assessment. Risk assessment. So as we have indicated, dear learner, employers are expected to carry out a risk assessment in accordance to various legal provisions. So there is a procedure for carrying out a risk assessment, and once that risk assessment is carried out, action is envisaged, that particular action must be taken as informed by the risk that has been assessed. And this risk assessment is supposed to be done internally and also externally. So what are some of the things that an organization may institute in relation to the risk assessment process? So one, hazard elimination. So one of the things that may be done, hazard elimination. And now, we will give an example here, Lana. So supposing you are working in an environment and you have gone to a section, and that particular section, you have noted there is some hazard. So maybe if it is a hazard in terms of the process, there could maybe what you call a process alteration. Process alteration. So if this process is altered, can it be able to eliminate the risk maybe workers are exposed to or other people? Then there's the element of substitution. Substitution. Now, supposing you are using a particular detergent. You are using a particular detergent or maybe a raw material. And you notice that this detergent is corrosive, right? This detergent is corrosive, for example. Then you can substitute that particular detergent with another one, but still achieve what you are expected to achieve. So this detergent or that raw material can be, for example, be substituted. So substitution of maybe a detergent or a raw material that is hazardous can be able to minimize that particular risk in that particular setting. Then there is also what you call the use of barriers. Use of barriers. So what happens here, dear learner, you may go to a machine room and you realize that the machine must, for example, have a particular belt that is rotating. So that belt could be the risk that you have observed could injure an employee. So the use of barriers may involve, for example, using fabrication, or maybe using some wire mesh that is, for example, put between the belt and maybe where the workers are, and that way you have actually put a barrier such that no employee can go to that particular side of the machine, and that one helps in reducing the risk. Then there is also the issue of use of procedures. Use of standard operating procedures. Standard operating procedures, or what you call SOPs, standard operating procedures. So, dear learner, what this means is that in areas where a risk has been assessed and it has been realized that if workers are left just to operate, for example, machines, there could be some danger. Then an organization may come up with a manual that says before this machine is started, you must ensure that the barrier, for example, is in place. You must ensure that the loading of the machine is in place. You must ensure that other features have been taken into consideration to minimize that particular danger and so on. So then the use of standard operating procedures can also be instituted in that particular arrangement. Then number 5, use of working systems. Use of working systems. Now, what do we mean by this now? Use of working systems, supposing you have a line operation. Then you must ensure that, for example, you have a shift supervisor, and this shift supervisor is well versed with safety in relation to the work that is being done. So in terms of a working system, in terms of that line, it means before you start any process, then the whole system has to be checked from the beginning to the end, and this supervisor may give what you call a work permit. or maybe what we're calling a permit to work, permit to work, permit to work. So this permit to work is signed and everything is in order before workers can start working and so on. And this working system can also have what you call the warning systems also. So that in some of the Japanese organizations, there could be a siren in case there is a problem on the line. Then what happens? There is a siren that goes on and that whole system now, for example, stops. So that working system or warning system can be able to assist in terms of that process. Then the last aspect in relation to action is the use of, the last aspect here is the use of personal protective equipment. Personal protective equipment, or what you call PPEs. So dear learner, you should note that personal protective equipment or PPEs like gloves and other issues should be used as the last resort. When all these other processes cannot work, then you now use personal protective equipment which are appropriate to that particular work operation or work activity. So those are some of the things, those are the 6 things that may follow, action that may follow risk assessment. So it means if you look at the first one, hazard elimination, a hazard has been detected, maybe in the process, it is altered. Maybe an item that is being used is risky, it is substituted. Maybe an operation that is open can also have a barrier. So based on the risk assessment that has been done, an organization can come up with intervention measures in that order. And as we have indicated, use of personal protective equipment is normally the last consideration in relation to safety at the work environment. So that is our third aspect in our lesson today. And the fourth one is control of occupational health. Control of occupational health. The fourth one is control of occupational health and hygiene problems. Control of occupational health and hygiene problems. Control of occupational health and hygiene problems. Now, when it comes to housekeeping issues within an operational environment, you have what you call housekeeping issues. Now, when it comes to housekeeping issues, what are some of the things that should be done to control the hazards or occupational health problems that workers may be exposed to? So one of the things that is supposed to be done is to eliminate the hazard at source. So one, elimination of hazard at source. So what this means is that you don't have to wait. If you are, for example, constructing a warehouse and you need, for example, a floor that is rough for that warehouse, then at the construction and design stage, then you must ensure that you eliminate the risk or you eliminate the hazard at that particular point when you are constructing the building. So that elimination of the hazard at source becomes one of the things that you need to do. Then two, you have what you call process engineering. Process engineering. So basically, the kind of processes that you are now supposed to use, you ensure that you build safety into that particular process. So through process engineering, you can be able to eliminate or control occupational health and safety and hygiene problems that may arise within the working context. And then you have what you call isolation of hazardous processes. Isolation of hazardous processes. You might, for example, dear learner, go to maybe to a hospital, and what they do if let's say the X-ray and imaging areas are risky areas, so it means you must isolate those wards that deal with issues to do with imaging and X-ray in environments where employees or patients cannot come into contact. So isolation of hazardous processes, they are put in an area where it is difficult to access or is only left out of bounds for people who are not supposed to work in those areas or are not authorized to be there. So that isolation of hazardous processes can also be one of the ways through which you can be able to control health and hygiene problems within a working environment. Then there is also the element of training workers. Training workers on safe practices, safe work practices. So workers can be trained in relation to how they can make their work maybe environment safe. So when workers are trained, then those workers can now be able to assist in ensuring that there is a safety within that particular environment. Then you also have what you call good housekeeping practices. Good housekeeping practices. So what do we mean by this? What we mean by this, dear learner, is that in terms of spillages within the work environment, those ones should be cleaned as the work continues to ensure that the work environment is clean at all times. There are no spillages to be able to create problems. Then you also have proper maintenance of plant and equipment. So if you have a routine, for example, to maintain machines maybe after every, say, 5 days, so that proper maintenance schedule is very important to be able to control occupational health and hygiene problems, so that now within a week or within 2 weeks, proper arrangements are made to ensure that that work environment is proper and so on. Then you also have what you call regular risk assessments. So these regular risk assessments can be impromptu. So you just decide you are going to check a particular section, and that section you are going to check, you don't inform the people who are there, you just go there, check whether now they are conforming to what has been put in place in terms of the operating standards and so on, then take intervention measures. So that regular process of risk assessments within a work environment can also be able to assist an organization solve the hygiene problems that may be associated with working environment. And then you have what you call proper ergonomic considerations. Proper ergonomic considerations. So when you talk about ergonomic considerations, you are talking about the interface between the worker and the machine. So if you have proper work machine interface, proper ergonomic considerations. So if you have a proper proper interface between a machine and the person, or a workstation and the worker. Take an example. If you have, let's say, a computer operator. So you ensure that the computer has got the shield that is supposed to shield that worker from the rays, and then the seat which the computer operator is using is also appropriate and well, for example, adjusted. Then that particular person can work with minimum strain. So you can be able to reduce the strain of that particular worker and ensure that that worker works very well and so on. So that again becomes one of the things that needs to be done. Then you have also what you call continuous medical checks. Continuous medical checks among the employees within the work environment. So continuous medical checks can ensure that anything that is detected within the work environment or within the work environment and so on can be addressed appropriately to ensure that occupational problems are basically minimized and so on. Then you also have what you call preventive medicine. So, dear learner, as we have indicated, there is the element of continuous medical checks where employees are subjected to continuing medical checks in the work environment, and where maybe challenges are found, intervention measures are taken. And number 10, preventive medicine. For example, in the era of COVID-19, workers can be sensitized in terms of washing hands, social distance, issues of, say, avoiding crowds and so on. So these ones are preventive medicine intervention measures that can be able to help workers avoid chances of getting COVID-19 through washing hands, maintaining social distance, also putting on masks properly. So that helps in ensuring that workers within the work environment can have an exposure, or maybe can control occupational health and hygiene problems to minimize exposure to risks that may arise within the work environment. Then the other aspect we need to look at, dear learner, is accidents we have said are prevalent within the work environment. So how can we prevent accidents? Accident prevention. Accident prevention. So when it comes to accident prevention, there are various measures that could be considered. For example, identification of causes of accidents. Identification of causes of accidents. So if accidents, because accidents are inherent in our work environment, so measures must be put in place to try and identify what are some of the probable causes of accidents. And then once that is put into consideration, intervention measures can be constituted. Then there's the element of consideration of safety, consideration of safety at the design stage. Design stage. So let us take an example. An organization is constructing maybe a building where they are going to have offices. So this building is a staircase. So the staircase that is being constructed to go to first floor or second floor or third floor, you can ensure that those particular staircases are constructed to particular standards which can be able to avoid workers, for example, being injured. So that consideration at the design stage for maybe building and equipment can also be one way of anticipating accidents and preventing them from occurring. Then there's the element of provision, provision of personal protective equipment. We have mentioned PPEs. There is also the issue of number 4, using standard operating procedures. These ones are SOPs. There are also processes of having what you call warning systems. For example, fire warnings. So basically, this is a system that can be triggered off if there is a fire in a section or a room. Then this warning systems comes on, then it can be able to alert other employees. Then there is also the issue of training workers on safe operations, so that workers have the knowledge and skills to ensure that they can be able to operate the machines and equipment safely and so on. And then you also have the continuing maintenance, maintenance So an organization does not have to wait for machines to break down or injure people for them to maintain them. So continuing maintenance routines are also important to ensure that an organization is able to meet its obligations. Then you also have fire extinguishing systems, fire extinguishing systems. Now, for example, you may have what you call sprinklers. Sprinklers. Now, these sprinklers in most cases are put in environments where, like if you have a basement parking, then the sprinkling, the fire extinguishing system is automatic. If there is that fire siren, then the sprinklers automatically bring out water. You don't have to wait for people to come. And by the time people are coming, that extinguishing process could have now, for example, prevented that accident within that work environment. So, dear learner, you can see the issue of the health of workers, as we've said, is very central. And as an employee or as a worker in a work environment or as a stakeholder in ensuring health and safety, you have to take this topic very, very seriously, because you can be able to assist an organization to save lives, save workers from being injured, save damage to property, save stoppage of processes, and ensure a work environment is safe. So we can very quickly again run through what we have done today. So in our lesson today, which was health and safety policies and procedures, we have looked at what is meant by health and safety policies and procedures, and we have said, dear learner, that health and safety policies and procedures are concerned with protecting employees and other people affected by what the organization produces and does against the hazards arising from their employment or their links with the organization. And we said we were going to look at these 1, 2, 3, 4, 5 things, which are activities in managing health and safety at work. We said we will look at hazards at work. We also indicated we will be looking at action following risk assessment. And we also indicated that we will be looking at control of occupational health and hygiene problems. And also we said we would look at accident prevention. So what did we look at when we looked at the activities in managing health and safety at work? So number 1, formulation of health and safety policies. Number 2, conducting risk assessments. Number 3, implementation of health and safety policies. Number 4, review of health and safety procedures. And then we looked at number 5, participation in health and safety committee work. Number 6, sensitization of employees on health and safety. Number 7, investigation of work-related accidents. Number 8, managing stress in the workplace. Number 9, health and safety equipment. So those are the activities we have looked at and discussed them and indicated that these are some of the activities in managing health and safety at work. Then, dear learner, we moved on and looked at some of the hazards or activities that may be associated with the hazards at work. And we have indicated that some of the hazards at work may occur at the point of receiving, number 1, point of receiving of raw materials. And then number 2, movement in the workplace, when there are movements from one section, from one department, from one activity to another one, workers could collide or they could occur a challenge there. Then when machines are being operated, number 3, machines are inherently hazardous. A machine could snap. So operating of machines can also pose a hazard. Number 4, working at heights. When individuals are working at a height, that could also pose a hazard if they are working on a ladder or working on a scaffold. Number 5, working with hand tools. Hand tools, sometimes they could, for example, be shaking, or maybe you need to position them. So that again can create a hazard and maybe injure an employee or cause an accident. Number 6, operating electric equipment. And if you're operating electric equipment and it's being supplied by a power source, that could also be a hazard, maybe a source of a hazard. Then number 7, sitting for long durations, that we have said can cause maybe lower back pain or other complications. Then processing of materials, some materials could be toxic. So that again is a source of a hazard. Then cleaning of gutters could be maybe below. And if an employee is working in that confined space, there could also be a hazard in that kind of work. Then work overload, when workers are given too much work, then that could trigger some stress levels among the workers. So those, dear learner, are some of the hazards or activities that may be associated with hazards at the work environment. Then we went ahead and looked at now what action can be taken when a risk assessment has been conducted. And we have indicated that number one, elimination of the hazard. If it is a process, it could be altered. Number two, substitution. If you have, say, a detergent and it is corrosive, it could be substituted with maybe another less corrosive detergent. Number three, use of barriers. For example, fabrications can be made to maybe block employees from coming into contact with a moving machine. Number four, use of standard operating procedures or having procedure manuals. That can also be useful. Number five, use of working systems or warning systems where there could be a warning if there is a danger, the machine stops or process stops. Then use of personal protective equipment, which we have said is the last line of protection when all the others have now not succeeded. Then we have also looked at the control of occupational health and hygiene problems. So how can organizations maybe sort out that issue of health and hygiene problems? So one, elimination of hazard at source. At the design stage, ensure you design the machine or the process well. Then process engineering, the way the processes are carried out, that can also be maybe corrected. Isolation of hazardous processes, and we say like in a hospital setting, the dangerous, like let's say X-ray related activities are isolated where patients cannot easily access. Then number four, training workers on safe work practices that can also help in controlling occupational health and hygiene problems. Good housekeeping practices to ensure the work environment is safe. Proper maintenance of plant and equipment. Number seven, regular risk assessments. Number eight, proper ergonomic considerations. The machine worker interface should be scientifically studied to ensure that they minimize on strain. Number nine, continuous medical checks and surveillance. Number 10, preventive medical medicine. For example, in the COVID-19 situation, workers should be exposed to preventive measures like washing of hands, social distance, proper use of masks, among other preventive approaches. Then ultimately we looked at accident preventions. So what are some of the intervention measures that may be put in place to help prevent accidents? So one, identification of causes of accidents and then mitigating on that. Two, consideration of safety at the design stage. When a design is being done, safety must be central. Then three, provision of personal protective equipment, PPEs. Four, using standard operating procedures, SOPs. And then number five, using warning systems. For example, fire warning systems can be able to be triggered on automatically through remote sensing. Number six, training workers on safe work operations. Number seven, continuing maintenance so that it's routine and continuous. And number eight, using fire extinguishing services, for example, facilities or systems like now automatic fire extinguishers that come into effect in case of a fire. So these are the things we have looked at in our lesson today. And before we finish our lesson, dear learner, you have an assignment. Discuss hazards. Your assignment, discuss hazards that might be inherent inherent in a workplace. Discuss hazards that might be inherent in a workplace. So dear learner, as we have noted, health and safety is very key. So take this particular content very seriously, because your own health, the health of other workers, the health of other people, the property of the employer, and anybody who comes into contact with what you do as an organization could suffer. So to minimize and mitigate in those areas, your administrative approach will be very crucial and will be very central to ensure we have a safe work environment for everybody. So thank you very much for being attentive in our lesson. We hope to see you in our subsequent lessons. Thank you.